So with the current ED wait times and ambulance ramping stats, anyone in Perth would be excited to hear there is a new hospital in town. The West Coast Surgical Institute are today opening a premises in Bentley, which includes 2 theatres, consulting rooms, and will offer services across a number of areas, they say, including oral dental surgery, trauma, dermatological, plastic and reconstructive surgery and general surgery. But is it private or public, and who will be able to access the services and when? I have the CEO of the hospital and head of the Medical Advisory Committee, Dr. Vivek Eranki on the line. Dr. Eranki, good afternoon.
Good afternoon, Christine. Thank you for having me.
Thanks for coming on. So Perth's newest hospital opens in Bentley as the headline of your media release, but who can use this facility?
Yeah, so the facility is actually open to all doctors and dentists across Perth. And we've actually been approached by several of Perth's leading doctors and dentists already. We've credentialed more than 10 practitioners. So we're very excited about the demand for the new hospital.
But is it a day surgery for private patients, I guess, is what I'm asking?
That's correct, yeah. So it's a day hospital, which means that it derives its fees from private health funds and from Medicare as well. And our aim is to essentially provide gap-free treatment wherever possible. We are also partnering with a national indigenous healthcare provider, which is Spartan First. And they are closely working to alleviate the current stress on the public sector by offering to take some of the public waitlists.
Yeah, I definitely want to talk to you about that as well and get some more detail. So just on the surgery as a whole, how do the referral pathways work? Do you see your GP and then you get referred to a specialist who uses the clinic? How does this work?
That is correct, yeah. So specialists usually are credentialed at various hospitals around Perth. And if you look at where all the hospitals in Perth are located, if you look at, for example, the day hospitals, there's about 15 Class A or general anaesthesia day hospitals in Perth, and the vast majority of them are in the inner city. So they're in Mount Lawley, Leederville, Subiaco, etc. So we are pretty much the only day hospital in the Eastern Corridor. And what happens is the GPs, for example, refer the patients onto the specialists who would then utilize this facility, or if they're on a wait list and that wait list has been picked for to be moved to a private hospital through Spartan First, and in that case, they would be using this hospital.
Okay, so what kind of procedures can take place here?
So we can undertake any procedure under general anesthesia that doesn't require overnight stay or stay in intensive or high dependency unit. Currently, we are maintaining our scope of practice to mainly dental traumas, plastics, reconstructive surgeries. We are also currently looking at gynecological surgeries as well as general surgery.
Okay, it is nearly 20 minutes past 1. Dr. Vivek Eranki is with me. We're talking about the Bentley campus of West Coast Surgical Institute, which opens this afternoon. So you mentioned that there is a component of the business that partners with First Nations organisation Spartan First, and I saw CEO Des Headland quoted as saying that First Nations people experience longer wait times for elective surgery, and the aim in partnering with the hospital is to augment and accelerate the healthcare options available to the community. So what percentage of your patient flow will be from the First Nations community?
At this point, we've just been licensed very recently, and we want to maximize that relationship as much as possible through Spartan First. And Spartan First primarily deals with First Nation healthcare as well as occupational healthcare as well. So it is predicated on the relationships that they have with other First Nation businesses. So at this point, we don't have the percentages with us.
Okay, all right. Just, like a ballpark figure, are you looking to, is it a quarter of your patient flow or?
Yeah, I mean, looking at the demographic in the Eastern Corridor and the lack of healthcare services available currently, yes, we would be very happy if we maximize it as much as possible. So even if we hit 25, 30%, we'd be very happy with that.
Okay, so how many people do you hope to take off the private wait list?
At this point, we would be able to accommodate 2 operating lists a day. And we are allowed to operate 5 days a week. It is a bit of a challenging situation in the public health sector, given that they are pretty much experiencing a perfect storm. So they basically, this is the busiest time of the year. They are still dealing with COVID. The number of new doctors coming in from overseas has dropped in the last couple of years. Existing doctors and nurses are having burnout issues. Considering everything, they're doing the best they can. But yeah, and we are here to help in any way we can. So if the more that they want to utilise us, we are very happy with that.
All right, so the official launch is 3:00 this afternoon. When do you open your doors?
We got the first list booked in next week, actually. So yeah, very excited about that. Dental extractions, and then there are a few other gynecological surgeries coming up after that, I believe.
Great. Well, thank you for giving me the detail. Dr. Vivek Eranki, thanks for coming on.
Thank you very much.
He's the CEO of the hospital and the head of the medical advisory committee. So that campus, that hospital is at Bentley. It's private. It is under the West Coast Surgical Institute banner. I think they also have offices in Subiaco. And the Health Minister, Amber Jade Sanderson, is going to be at the opening this afternoon. It is 24